and 2 were in overseas acquired in hotel quarantine. So we have had 9,356 tests done yesterday. So can I please say to Queenslanders, if you are sick, please go and get tested. It's absolutely vital, especially now with our borders open to New South Wales, Victoria and ACT. In terms of vaccines, great to see Queenslanders still getting vaccinated. 10,082 vaccines were done yesterday. 88.32% of Queenslanders have now had their first dose, so we're really climbing up to that 90%, and 81.23% have had their second dose. Can I also today especially welcome Dr. John Gerard, who starts as our Chief Health Officer, and can I also say a very happy birthday. It's his 60th birthday. I hope that wasn't a secret. And we wish you all the very best, and we welcome you here for this really important job, and we know that Queenslanders will also be very appreciative of the hard work that you will do. So today, of course, is a very important day, and throughout the pandemic, families have had to deal with circumstances beyond their controls. Today, we have seen families reunited. That was always part of our plan when we released our roadmap to reunite families. Families who are coming from New South Wales, Victoria and ACT who are double vaccinated, coming in having had their PCR test to see their loved ones. This is a special time of year. We always said that Christmas is a special time of year for family and friends to reunite, and very emotional scenes today right across the state, especially at airports and of course our borders. At the moment too, can I pay special tribute to all of our health workers during the nearly last 2 years of dealing with this pandemic, where Queenslanders have been very fortunate not to experience the waves that we've seen in other states and around the world. Tragically, 7 people have lost their lives, but never did I think that we would reach the stage where we are almost at 90% first dose, and we have not had the large numbers of deaths that we have seen in other parts of the world. Can I also thank the police? The police have done extraordinary jobs on our borders, and they're continuing to do that. From all accounts, things have been going quite smoothly. There have been some delays, as we expected, but people, I think, are genuinely appreciative that the fact that the wait is now over and they can come progressively into Queensland. But the police have manned our borders night and day. We have had strong border measures put in place to keep your family safe in Queensland, and the results speak for themselves. I'm very proud of the work that every single Queenslander has done, and I hope that over this festive season you get to spend time with your loved ones, especially when you are reuniting during this time. So I'll hand over to Dr. Gerard and then the Health Minister and the Police Commissioner. Thanks.
Thank you very much, Premier. Today is a very important day for Queensland. Now that all Queenslanders have had access to safe and effective vaccines, it's now time to open the borders very cautiously. And so we are very cautiously allowing people to enter Queensland. But what we do know is that as these numbers increase, we will see increasing numbers of incursions, increasing numbers of cases in Queensland. Although we screen patients prior to their crossing the border into Queensland, some unknowingly will be incubating the virus, and we do know that there will be cases in Queensland in the coming weeks and months. Now, up until now, because of the high vaccination rates, all we've been seeing are spot fires, and for the most part, these spot fires have been brought under control. But as time goes by, it is highly likely, it's inevitable, that the case numbers will increase. How many we will see and when this will occur is still unclear. As we've heard today, or in the last 24 hours, we've reported 10 cases of COVID-19 in Queensland, but of those 10, 9 were already in quarantine from interstate or overseas. There were 3 from Victoria, 4 acquired in New South Wales and 2 acquired overseas. There's one case that was in the community on the Sunshine Coast, a man in the community on the Sunshine Coast between the 8th and the 12th of December, who acquired his, or probably acquired his infection at a known site in northern New South Wales. Quite a number of our incursions have occurred from northern New South Wales in the last few weeks, you'll notice. We're currently investigating where this gentleman has been, but fortunately it appears that he has not had a great deal of contact in the public domain. We've done 9,356 tests in the last 24 hours. There are 56 active cases. We've so far seen a total of 2,176 cases in Queensland, and we have 28 inpatients at the moment with COVID-19. Now, as we go forward with this pandemic, we'll be focusing less and less on the individual cases and focusing more and more on the trends and looking to see if we're getting exponential increases in numbers in the community and or in the hospital. Most patients, the vast majority of people with COVID-19 in the future, will be managed at home. And we have systems now set up to start managing patients at home with COVID-19. Now, obviously, Omicron has thrown a little bit of a curveball to us, but early data suggests that the vaccine is effective, and that particularly with a third dose after 5 months, that there is a good antibody response, and it's likely that this will be very effective in preventing Omicron infection. So we are encouraging people who have received their last dose of vaccine more than 5 months ago to receive a booster shot as soon as possible, so particularly as we're opening borders now. Obviously, if you haven't had your first dose yet, as we are opening the border, this is the time to be getting it. Okay, thank you very much.
So 10 cases today. I can update that one of the cases that we announced over the weekend, which was the casual contact who had been to Bunnings, there's been further testing done, and this person has now been deemed a false positive. So they will be coming off our total account, which is great because it means that we have not had any transmission in the community to casual contacts thus far, despite the number of different incursions we've had announced on the Gold Coast in the last week. But we do remind people on the Gold Coast, please come forward and get tested if you have any symptoms whatsoever. Remember, you don't want to put your family and friends and loved ones at risk where potentially you could be spreading COVID. So please come out and get tested. It's more important than ever. And of course, anywhere in Queensland, but particularly on the Gold Coast, come and get vaccinated because your vaccination rates are not as high as the rest of southeast Queensland, particularly Brisbane. Now, it is critical that people continue to go get tested, to check in and to vaccinate. I have to say, I was out a fair bit over the weekend doing Christmas shopping. I saw very few checking in at stores. So please, it is absolutely critical that we are able to tell you that you have been in contact with a positive case very quickly. We can't do that if you're not checking in and we don't have that information. So the system is so easy, it's so quick, there is no reason not to be checking in. And we know come Friday the 17th, it'll be more important than ever that while you're checking in, you're also able to show your vaccination status. So I remind people as we lead into Friday, download your vaccination status on your check-in app. Alternatively, you can have available on your Medicare app to show businesses. Or if you don't have a smartphone, you can ask one of your friends or even go to your GP or pharmacy and ask them to print out your vaccination status, and you can just carry a physical hard copy around with you. The last thing I want to say is boosters are now available. We heard the advice and the announcement by ATAGI over the weekend that people can now come forward for their booster at 5 months instead of 6. We did see more people coming out at our vaccination centres yesterday for their booster, and we welcome people coming and getting their booster as soon as it is available. I know I will as soon as it's available. You can get your Pfizer booster at any one of our state vaccination centres, but you can also get Pfizer or Moderna at your pharmacies or at your GPs. So there is plenty of opportunity to go get your booster shot. at many, many sites across Queensland. And of course, you don't have to worry about your booster if you haven't even got your first dose. So come out, get your first dose so that you can get on that journey to get your second and then get your booster, because we know that booster is important when we see more and more cases of Omicron coming through our community. Thank you. Oh, can I also just say, Police Commissioner, amazing job. Thank you to the Queensland Police Service, the amazing work our police have been doing on our borders for almost 2 years now, but particularly the work they've done on the border pass and the work on our borders and at the airports over the last few hours has just been extraordinary, and a huge shout out to our police and of course our ongoing work of our health workers.
Thank you, Premier, and thank you, Minister. Yes, it is absolutely fantastic morning this morning. The pass system throughout the night has worked beautifully. As of this morning at 10 a.m, 23,500 applications for the GV pass. So this is the pass from the hotspots, obviously double vaccination as well as that test within 72 hours. So 23,500. Pleasingly this morning, we have not had long delays. On the N1 currently, it is up to 20 minutes. In other areas, just up to 10 minutes. That was up to about an hour earlier in the morning, but a sincere thank you to all of those who heeded the message not to travel through peak hour. That has worked exceptionally well. Today, we have 25 domestic flights into the Gold Coast and 43 into Brisbane. And I know these numbers will increase dramatically in the next few days. The initial flight from the hotspot of Sydney went extraordinarily well this morning, and you will see all of those families and loved ones getting together as we all did this morning. There were no quarantine requirements in that flight. What has been a bit of a niggling issue, and can I ask everyone that they really do take their time filling out the border pass. It only takes 5 minutes. It's very, very easy, and it'll actually guide you to the pass that you require. But some people are reading through that quite quickly and not obtaining the right pass. And also, we've had a few incidents where people have come to the border, the road border, or even on a flight without any pass. You must have a pass coming into Queensland. Whilst we have been pulling those people aside and assisting them, it obviously takes so much longer than when we have to do that. When you get the opportunity, please print your pass off, particularly at the road borders, display it on the dash. Again, it makes the system so much quicker. I can appreciate through the night that mightn't be able to occur because people in caravans don't have printers, etc. That's fine, just have it on your phone. But into the future, to make things go even more seamlessly, please print it off if you can. Make sure you've got the right pass. And as I said, incredibly pleasing. To all the police and to all the health workers out there, a sincere thank you. You're doing an amazing job, and you've obviously got us to where we are at the moment. Thank you.
Thanks, Commissioner. We're happy to take some questions. I hope so. I don't think anyone can. But, you know, we've got the plan in place, and, you know, we've got a national plan we've agreed to, and we expect that the vaccination rates are going to hold up quite well.
Queensland's done so well in keeping the virus out, but the human cost has been people have been stuck over the borders. And we're seeing all the happy scenes at the airport today.
Yeah.
Many people are angry about, you know, specific points they may raise would be the speed of government, the Queensland government's response to their questions, or special access or treatment given to sports stars. What do you say to those people who are angry at your government today?
I say today's a happy day. Today's a great day. It's a very emotional day for many people, and people only have to look at the strong health response that has also seen Queensland leading the nation when it comes to the economy and the economic response. I say to those people that people here have been able to go to school, kids have been going to school, people have been going to work, and we have had relatively few lockdowns when you consider the toll that has taken in southern states when they've had long lockdowns and the mental health strain that has put on people. No one has a perfect solution, but I'm very proud of the whole work that Queenslanders have done over the last nearly 2 years of this pandemic. They've not been ignored. We've kept Queenslanders safe. That's exactly what I have said, and that's exactly what has happened. And like I said earlier, in my earlier comments, I never thought I'd see the day where we're opening up with over 80% double dose in Queensland.
Premier, come Friday, are you confident the system will have the capacity to do all that additional COVID testing that's required for people flying in today? Well, between the government facilities and the private pathology units that you use, I think some peak at around about 30,000. This could be 50,000.
Oh, in terms of the testing?
The testing, is that all geared up? Ready?
Yeah, my understanding is, but the Health Minister might want to comment a bit further about that in a moment. Yeah.
Premier, obviously so much uncertainty over the past 2 years, but can you provide any certainty today about the borders? Will they stay open?
We've got a national plan, and the national plan is to keep borders open.
Premier, are you concerned about business owners being abused or attacked come Friday when the vaccine mandates come into force?
I might get the Police Commissioner to talk about that, but very clearly there'll be some further information coming out this week from our Small Business Minister, and I ask people to be respectful. Now, let's remember that the majority of people here are vaccinated. The majority of people have gone out and got their vaccine to keep themselves safe, their family safe, and their community safe. And if any business owners have any issues, they should contact police.
Premier, we've had reports that people getting on flights from Sydney today weren't asked at all to provide any proof of vaccination and their paperwork wasn't checked. Is that supposed to be happening?
Yes, there's random checks. It is physically impossible to check every single person. I think the Police Commissioner had figures this morning about the number of flights coming into Brisbane and the Gold Coast. But if they are not abiding by the rules, they are putting the whole state at risk. So people know very clearly that there are heavy fines associated if you do not do the right thing. And we are allowing fully vaccinated people into this state to see their family and friends.
Do the airlines have a role to play there, Premier, do you think, in determining whether their customers are double vaccinated to help you?
Look, the airlines have said that is impossible for them to do as well.
We've seen instances in New South Wales and Victoria where shops have been defaced and shop owners even pushed down an escalator for refusing entry to people. What do you say to workers who might be afraid to come to work on Friday?
I don't think they should be afraid. I think, unfortunately, what everyone's going to realise is we are in a world pandemic, and this is not unusual, these steps that have been put in place that are being applied in other countries around the world. This is about keeping the community safe. Now, the other thing that's very important is about keeping our children safe until they're vaccinated. So I think families want to know that they can go into a cafe or a restaurant with their families in the lead up to Christmas and after Christmas, knowing that everyone in that restaurant or cafe is fully vaccinated. This virus is now the pandemic of the unvaccinated. Our children will now be able to get that vaccine in the middle of January, in time for going back into the school year. But I think it's very, very important that people understand that they want to be in areas where there are people who are vaccinated. Now, nearly 90% of Queenslanders have gone and got vaccinated. I understand that some people still may have concerns. Can I please say to you, don't look at the misinformation on the internet that's running on social media. Please go and have that one-on-one conversation with your trusted family doctor or your friends who have been vaccinated. There are a lot of avenues out there. Or come into one of our health clinics and sit down and speak to a nurse if you have any concerns.
Will the vaccine be mandated at schools for kids coming in?
It's, I'll find out for you. I don't think it's mandated for children. I'll check on that one. I don't know.
Have you read the full CCC report yet, Premier?
I'm in the process of reading it, Tim, and as I said, Cabinet will be discussing that in January, and I'm not giving any further comment.
Premier, just in terms of kickstarting the Queensland tourism sector, the head of Jetstar came out this morning saying that the number of flights booked for the next few weeks is very encouraging. Flight Centre had projected a 70% increase in the interest in Queensland as a destination just in the last week since you made.
Well, you can't blame people for wanting to come to Queensland, can you? I mean, it's holiday time. People love coming to this fantastic state. And you know what's been really encouraging over these last 2 years, and don't forget, people in New South Wales and Victoria have been in lockdown. Queenslanders have gone and supported the tourism industry. So, you know, I said early on in the pandemic for people to go and support out in the West, and I met people out there and they were doing that. They were supporting those small outback communities. Then we asked them to go and support the regional areas, and they did that, to support Cairns, to support the Gold Coast. And my understanding is that holiday bookings are very high, but Also too, with a lot of people, also we know that this virus is going to spread. So it's really important that people are checking in. Now, Queenslanders do that all the time, but I want to make sure that people who are coming into our state do that. And also too, it's really imperative if people are sick to go and get tested so they can isolate if they are ill. I mean, we want to protect everything that Queenslanders have worked hard to, but we also want people to enjoy their Christmas and New Year. Sure.
Do we know yet if Omicron is more or less dangerous in terms of how it makes people feel and symptoms and whatnot?
We don't know for certain. The evidence suggests that it's no worse than the previous strains. There is some anecdotal suggestion that it might be milder than previous strains, but that's anecdotal. But there's no signal that it's worse. It's the first thing we can say. That's the first priority. If it's milder, that would be a Christmas gift, wouldn't it?
How long do you expect it to take before there is some solid information about this strain?
Okay, there are two ways we're getting information. One is through the laboratory and the other is through human studies. The laboratory data is already coming through on how good vaccinations are against the virus in terms of neutralising the virus. And what we're seeing is that within the first 5 months of being vaccinated, there's good neutralisation of the virus, but that wanes after 5 months. But I must emphasise, with that booster, the neutralising antibody levels rise dramatically. So that third booster really seems to be very important in developing very strong immunity against probably Omicron, but also all COVID strains. So the third dose of the vaccine, you're seeing these very substantial rises in the antibody levels. I've had my third dose, and hopefully all of you will have yours soon.
Dr. Gerard, you said we've been dealing with spot fires in
Yes.
Queensland in terms of COVID cases. What's the modelling show though on how many cases we expect, say, in the first 90 days? I know there was that research by QANR showing like 2,000 people might end up in hospital, worst case scenario, but what kind of numbers?
The problem is, of course, everything is changing continually. Most of our projections were based on the Doherty modelling, which looked at 80% sort of maximum, and we've exceeded that 80%. That I don't think any of us expected that. I thought we would be hard pushed to get to 70% vaccination rates. And so when they were talking about 80%, I thought that was a dream. Now we're pushing towards 90%. And certainly the Doherty modelling hasn't looked at the 90%, well, not that I've seen on the 90% modelling. The slight spanner in the works, of course, is Omicron. We don't quite know where that fits. Now, you're just going back to the question you asked before in terms of information. The most important information we need to get is from real people, and that's going to take, unfortunately, that's going to take quite a few weeks to get from particularly South Africa and elsewhere. It'll probably take 6-8 weeks before we started getting meaningful human information in terms of severity, protection from vaccine, etc.
Based on that forecast of 50,000 arrivals today, just further to the question of the Premier earlier, what's the capacity for the testing system between the government and the private pathology clinics to handle that new load for Friday?
I myself am not familiar with that information yet. I've only just started in the job.
When do you expect our COVID cases to peak here in Queensland?
Again, we don't know for certain. The original Doherty modelling suggested there would be a lag of several weeks to months, and that the general feeling is that the peak will be as it gets cooler. But we don't know for certain, as it starts to get cooler in 3-4 months' time.
Do we know in January yet when we're going to hit the 90% double dose? Is there a date?
Sometime in January.
With all these extra people here, are you expecting, say, hundreds of extra cases over the coming months?
I think we can expect hundreds of extra spot fires, and they would transmit to others. So I think we'll see more than hundreds, quite possibly in the next few months. But can I just point out, okay, I've been seeing COVID cases now since the beginning of 2020. People who are vaccinated don't get very sick. They don't get very sick at all. So they'll get they may get no symptoms, or they may get a mild cold. These aren't people that will be filling up our hospitals. We'll have a system to monitor them at home, but we're not concerned about the vast majority of vaccinated people who get COVID-19 because their illness really is mild. It's the small minority, mostly unvaccinated, who gets very sick. Occasionally, particularly older people or people with immune dysfunction who are vaccinated can get sick. That does happen. I won't say it doesn't happen. It's mostly the unvaccinated. But the vast majority of vaccinated people do not get very sick at all.
Minister, can I just ask you a question referred to you by the Premier regarding the testing capacity
20,000, not 50.
for Friday, and how that's going to be monitored?
Yeah.
50,000 was estimated coming in.
Yeah.
It's about 30,000.
Sure, yeah, first of all, I believe the figures were 23,000 passes at the moment. That's 23,000 people probably coming in the next 72 hours, remembering there's 72-hour windows as far as people have to have had a negative PCR test in the 72 hours. So they're not all coming in on day one. That 23,000, which will keep moving, and yes, it will keep increasing, that's over 3 days they'll need to turn up for their day 5 test. So am I confident that we can cope with that? Yes, we will monitor it very closely. We're very mindful of the requirements for testing and people having to get that day 5 test. We'll also keep looking at the national guidance and advice on this, whether we need to keep maintaining that testing into the future. But right now, when we're only at 80% double dose, and we've just opened the borders, we will do the day 5 test, but we'll monitor it very closely.
Is there actually clinics being opened up, or is it just what we have?
Yeah, just we've been able to cope with very high testing rates when we've had big surges. Remembering that we've had big surges, or when you look at Indooroopilly cluster and other clusters, it's predominantly been in southeast Queensland. So we've done tens of thousands of tests, in 24-hour periods, all in southeast Queensland. I hate to say, but this virus is going to be spread across Queensland. So the testing's not all going to be just in Brisbane here. These are 23,000 people who are coming in the next 72 hours, and they're going everywhere in Queensland. So the testing is actually spread across many, many more clinics than normally what would happen when we have an outbreak. So I'm confident that we'll have the capacity.
Can I just check on the community case? So this is a bloke.
Yes.
who's-
He lives on the Sunshine Coast. He's been at a Byron Bay exposure site, as I understand.
And there were a couple of new exposure sites.
Yes.
Sunnybank, is that linked to?
I believe so, yeah.
Yes.
Yes.
Seems like people heeded your call, in fact, their motions calm seems order this one.
Look, I thank the public for heeding that call. There were people lining up, as you appreciate, at 1 o'clock this morning, both not just in Brisbane, the Gold Coast, but Gundawindi. As I said, there was that 1 hour delay, which is now dramatically reduced. A sincere thank you. Well done. Keep up the good work. Please, as I said before, make sure that you go through those questions thoroughly. It does only take 10 minutes, and it certainly does help to quicken up the process.
With the businesses on Friday, can you talk us through your approach to compliance? Will there be extra compliance checks? And at what stage do you start fining businesses and also patrons who refuse to go along with the new laws?
So we've planned for this for a number of months, and we do have a very strict compliance regime already in place. We already have a sense that there are some businesses that won't comply, so we're all geared up for that. But anyone who treats staff disrespectfully, police will be called and they will be dealt with. I mean, it's completely unacceptable. We know for a long period of time now that this date is coming, so we ask businesses do the right thing, have the signage out, obviously make the request like they do now in the general course of, checking when people come in. It's just an extension of that. But obviously if they have concerns, people are not doing the right thing, to call the police. I ask, though, like Queenslanders have always done, please be compliant in this space. There is heavy fines here. It's $1,300 for individuals, and it's over $6,000 for businesses. It is going to be a big day on Friday, but please, as we have done very well here, please comply, do the right thing. We've always taken a very educated approach to this, one of compassion, one of communication, and finally, if there's blatant disregard for the directions, action will be taken.
Do you have any numbers on the number of people who are actually you're expecting to enter
So we've definitely got the 23,000 by 10 o'clock this morning. We expect that number to increase, but we don't know if they're all entering today. So people will apply for the pass now and maybe within the next 72 hours when they have the test. There is, as I've indicated, considerable flights coming in, 25 into the Gold Coast, 43 into Brisbane. We also know those numbers will increase over the next few days as well. So when I say up to 50,000, I would say definitely in the next few days up to 50,000 people.
So 23,000 people have been today already.
So 23,000 people have applied for the pass up until 10, and they might enter tomorrow or the day after, as long as that 72-hour period is there for the PCR test.
And there's no number on what you've seen physically yet at the borders for how many people have entered?
Sorry?
There's no number?
No numbers yet, but we'll have that as well. And we always have a daily tally at the borders, so it would be what the normal tally is, you know, people crossing, plus in addition to that, but we'll have those numbers tomorrow.
So the Minister last week announced the new heavy fines for people who are using frontline staff in hospitality and retail. Retailers say there's no greater deterrent than a police presence. What sort of guarantee can you give in terms of numbers on the ground to deter people from that behaviour before it becomes a problem?
So I appreciate, and I agree, police are an extraordinary visible deterrent, but you can't have a police officer on every street either, almost physically impossible. But police, if there is a job recorded to go to shops that are obviously experiencing problems, police will turn out to that. I ask sincerely again that everyone does the right thing in this space. We will turn up and we will take action, always. So please do the right thing, and I appreciate the announcement, or if, you know, those additional protections for staff. I think that's a great deterrent, extraordinarily important. And look, it just might not be just an infringement notice. It may be charges, it may be before the courts as well.
For those people turning up without their border passes, you mentioned those Omicron issues. Have you turned anyone actually physically around?
There has been some, and I don't know the numbers yet, particularly at the border, that believe they didn't require a pass at all. So they have been turned around, and I can get those numbers as well. But in most part, those that just didn't know how to fill it out well enough have been pulled aside and given the assistance they need. And even this morning, those that didn't turn up without a pass were actually compliant with the criteria, just needed to do the pass. So, thank you.
Mr. Marlena's question earlier, there's no mandate for children to be vaccinated, but when children can get vaccinated, parents should go and talk to their GPs about that 5 to 12-year-old age group, because ATAGI's just approved it. Okay? Thank you.
Thanks, everyone.